Hi, my name is Brianna Wilson, and this is my cultural integration presentation, which aims to inform and educate counselors about how the Christian culture may play a role in sexual dysfunctions, most specifically the etiology and treatment. In other words, if a client comes to you seeking help with sexual dysfunctions, their Christian view and values can be informative to your assessment and aid in treatment. So let's begin by exploring the Diagnostic and Statistical Manual of Mental Disorders, or DSM, to understand what sexual dysfunction really is. In a general sense, sexual dysfunctions are marked by significant disturbances in the ability to respond sexually or to experience sexual pleasure, and this lasts for greater than 6 months. This disturbance is not better explained medically or by substances or by significant stressors like the death of a significant person in their life or a loss of a job. It's important to note that an individual may have several sexual dysfunctions at the same time. So next, when a diagnosis is made, subtypes can be specified, which are identifying the onset as a lifelong onset or acquired, which means after normal sexual function. Lifelong would be something that they have experienced their entire life. Another subtype is general or situational. So is it a general sense no matter what the situation is, or the partner, or the type of stimulation? Or is it situational that it occurs? The specific dysfunctions that may be of greatest significance in this area of concern are inhibited sexual desire disorder, or ISD. It's also known as male hypoactive sexual desire disorder, HSDD, and the female type is known as female sexual interest or arousal disorder. So, however, we must note the DSM says it's important that the diagnosis is not given for significant disturbances caused by a lack of adequate stimulation or where sexual education would be necessary. So what are the concerns for Christians? Well, as far as etiology, these sexual dysfunctions may be a result of distress, anxiety, shame, guilt, or depression that may develop because of the conflict surrounding sexual activity within the context of the Christian culture. Where might these negative affects originate? Sexual activity in the context of a Christian view can be made to feel dirty or bad. This creates shame and guilt. Sexual activity creates fear around an unintended pregnancy, anxiety about the level of vulnerability, flaws in body image, or an unfulfilling relationship can cause depression and distress. So let's hear from a psychologist who authored the book, Beyond the Birds and the Bees. According to Dr. Popcak, inhibited sexual desire disorder is most often due to a devaluation of the spiritual and psychological dimensions of sexuality. And it is one of the most prevalent psychological and relationship problem in Western society. In other words, if Christians have yet to appreciate the spiritual and psychological pieces of sexuality, relationship problems will continue to prevail. So let's work to unpack some of the main concepts within the Christian view. According to Christopher West, Christians desire to embrace the body in its entirety. sex was something that was created by God. It's a gift, and it's intended to be pleasurable. It's intended to be procreative, and it bonds couples. But it also comes with its responsibilities regarding the dignity of the human person and what can result from sexual unions, which are children. Sexual activity would be within a sexual union, and the family which is created reveals the love of God to the entire world. So to say it simply, sex has purpose and great meaning. Now let's move to the treatment. The treatment within the Christian culture may be centered around education as far as the Christian view, unpacking the beauty of the full expression of love, and certain therapies like narrative therapy, which is introduced or is informed through this book of family therapy. Narrative can decrease internalization and work to empower the client. According to Nichols, narrative therapy aims to separate the individual from the problem, which allows externalization of problems rather than internalization. This is also described as understanding that the problem is the problem. The person is not the problem. Some other considerations to kind of make this a more complete study is looking at other religions and how they view sexuality. Those things are not well expressed in this video, and that would enhance the therapist's way of helping individuals who are finding their cultural, religious views conflicting and causing sexual dysfunctions in their relationships. Thank you.